Said, my name is Anthony Bates. I've been working as a GP for Kambu for about the last 3 years. I see quite a few faces out there that I do recognize, and some of my patients or family members of my patients, but a lot of people that probably don't know me either. And I've actually stepped into the clinical director role as of earlier this year. So rather than go on a whole lot about what's happening with the organization, I thought I'd keep it focused, although it might be something that people are probably sick of talking about. I know that I'm sick of talking about it and hearing about it, but it's very relevant right now, which is COVID. Most of you have probably seen the fact that the Queensland target of 80% vaccination rates has actually been achieved a bit earlier than expected. Their goal was the 17th of December. As of yesterday, the 13th, they've managed to hit that 80% goal, and they have opened up some travel restrictions to interstate people. So it's a little bit easier for people to get around, which I think is fantastic leading into Christmas. It makes it easier for families to get together and to see each other over the holidays. But that does increase the risk of having COVID spread throughout our state, throughout our communities. And the best way for us to be able to manage that and to be able to stop that and really protect ourselves is to get vaccinated. So I thought I might take this opportunity. I know there's a lot of people that still have fears, concerns, issues, things that they're worried about in terms of the vaccine, and I thought I might take this opportunity to do just a brief question and answer. If anyone does have any concerns or any questions or things that they'd like addressed about the vaccine, any of the vaccines, I'm happy to have a chat to all of you here about it today.
I'd just like to know if you're going to send us out a reminder to get that third one.
Yes, we will. So from the advice on ATAGI, they've just changed that, so now it's a booster at 5 months after your second dose. So they were saying 6 months, but with that new Omicron variant of the virus, it's now 5 months. So what we do is we try every week to run a report to see all of the patients who are due for it, and send out an SMS, a text reminder, to let you know when you're eligible to come in and get it. Yep. Yes, so the question was whether or not there's a booster for the AstraZeneca. So if you are someone who has received AstraZeneca for the first 2 doses, you are actually eligible to come in to get Pfizer or Moderna as the booster dose. They haven't approved AstraZeneca as a booster dose just yet, but you're still eligible to come in for the Pfizer or the Moderna now. Yeah, and it's just as effective as well. They've actually done studies where they've looked at antibody rates in terms of having 2 different types of vaccines, and having a different vaccine from the first 2 that you had, it's still very, very, very effective in terms of boosting those antibody numbers. Yep.
I'm just wanting to ask, if you've had the AstraZeneca, both of them, how long do you have to wait to then have the third one, as you had to wait 3 months between the first and second? So what's the time frame of the booster? So
the time frame, it doesn't matter which one that you had for the first and the second doses, the time frame is still 5 months. So after if you've had AstraZeneca for the first and the second, 5 months after that second dose, you're eligible to have that booster shot.
Thank you.
Yep. Yes? Yes, yeah. So in January, early January, we are meant to be getting our new vaccines for that 5 to 11-year-old age range. Hopefully we should have those no later than the 10th of January, most likely a bit earlier than that. And then as soon as we have those vaccines in hand, we'll be doing a whole lot of promotion and a whole bunch of extra events to try to get that age group vaccinated as well. Yep.
Yeah, I wanted to came with them, but I had an appointment to give me third. They knocked me back, they said come back on the 19th. Where do I stand with that? Do I wait on the 19th or do I go in there?
I'd have to take a look at the date that you had your second dose, if you know that off.
June.
If it was June, it's probably because that advice about the 5 months hadn't come out just yet. And so they probably recommended waiting that full 6 months. If your second dose was in June, you should be good to go by now. Yep.
Any more questions?
Any other questions? And it doesn't even have to be about boosters or no bad questions. Yes?
How hard are you trying to get more doctors so that people can get access to the service?
Very, very hard. Thank you. Yes, that is one of the things that we have been trying to do all year long, actually. All year long, there has been an issue with shortages in GP availability and people who have showed their interest in coming to the clinic. Luckily, at the end of this year, we've had a huge turnaround in terms of that, and we've had more doctors that we can actually bring on express their interest in coming. We've got another 3 full-time GPs coming, plus the new Aboriginal doctor who will be part SMO and part-time seeing patients as well. So we expect mid to end of January, we should have basically a full complement of GPs and much, much easier availability for appointments for everyone.
What do you class as a full complement?
That's basically the maximum that we can have in the clinic based on the space that we have, which is 6 full-time GPs. All right, well, thank you very much, everyone. I hope you enjoyed the lunch. It's really good to see so many faces here today.
Thank you, Dr. Bates.